Hi everyone, my name's Maya. I intern at Claremont Regional Medical Center, and for my field project, I chose to do a research project. For my project, I decided to create my own social needs assessment that could be administered at Claremont. The questions on there are: 1, do you have a primary care provider? And if not, would you like assistance getting established with one? 2, do you have trouble affording your medications? 3, do you have adequate housing? 4, do you have trouble getting food? 5, do you have any transportation issues? 6, do you have a problem with substance use? And if yes, would you like resources for treatment options? 8, do you feel safe in your home? 9, is someone forcing you to do something that you don't want to do? 10, are you unemployed or without regular income? 11, do you have any mental health concerns? And if yes, would you like resources for treatment or counseling? 12, if you're pregnant, do you have access to prenatal care? And if not, would you like assistance getting set up with a pregnancy care manager? 13, do you have trouble finding childcare? If yes, would you like resources to help with finding childcare? And 14, do you have thoughts of hurting yourself or someone else? If yes, whom? And if yes, have you ever done something to hurt yourself or someone else before? All of these questions I put on there because Claremont does have resources to help with these problems, or we are connected with other agencies that can help. So one of the reasons I chose to make this my research project is because in the ED, I noticed a lot of the frequent flyers, as they call them, were returning to the ED more for social reasons, most frequently being substance use, homelessness, and lack of a primary care provider, and not medical reasons. And so when I realized this, I wondered if there was anything that could be done, not only to ensure that these patients were getting their needs met, but also to reduce the number of patients who came to the ED for non-emergent reasons, thereby reducing ED overflow. And so by not only addressing the patient's medical needs, but also addressing their social needs, we would be serving Claremont's mission, which is to provide compassionate, excellent, and highly reliable care. And regarding my own personal professional development, I think that at the beginning of the semester, I was just kind of complacent and I would go through the motions of completing the consults without questioning why so many people were returning so fast. But as I grew as a social worker and an intern, I started to think critically about the reasons that we had so many frequent flyers and what we could do to help them. Part of my planning for this research project was to research the correlation between administering social needs assessments to patients in the ED. One study found that an intervention like this could reduce emergency department use by those high utilizing patients by up to 83%. And a lot of the other studies that I looked at found that same success. So seeing all of the success that these studies had, I decided to create my own social needs screening tool that could be used at Claremont. The questions that I put on the screening tool were influenced by the common social reasons that people were returning to the ED, the social problems we saw in the birthplace, and other social determinants of health. Since we're not in field anymore, obviously I wasn't able to implement this like I would have liked to, but theoretically the way it would work is it would be administered to every patient in every unit of the hospital. I know I've talked a lot about the ED just because that's where I was placed for most of the semester and that's where my inspiration for this project came from, but I think it would be a good idea to have it implemented in all units of the hospital. The patients would fill out the questionnaire themselves and return it to the nurse. And the reason that I had them fill it out themselves instead of it being administered by a case manager is feasibility. I don't think it would be feasible nor an effective use of time for the case managers to administer the questionnaire to every patient. And I also think that it's probable that a patient is more likely to disclose an issue on a written self-administered questionnaire rather than having to verbally answer yes to personal, potentially embarrassing questions. So once the patient returns the questionnaire to the nurse, if any yes boxes were checked, the nurse would put in a social work order. And if number 14, the question about having thoughts of hurting themselves or someone else, if that one was checked, then both social work and psychiatry would be notified. Lastly, I just wanted to acknowledge that I do admit that initially this would probably create a lot more work for the case managers, but I think it is an important task and one that has incredible potential to positively impact a lot of patients. Thank you for watching.